On Friday night, Payton Pritchard of the Boston Celtics suffered a right knee injury in a game against the 67s. Now, reports state that he has suffered a right knee sprain. Let's discuss what this is in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that an average fan can better understand them. Be sure to like and subscribe if you want to stay up to date on my content. For now, let's get back to the right knee injury. All right, so let's take a look at the injury head on. I find that this is the best view of the actual injury of Payton. And let's just play it and see what's going on. So this is a slow-mo here. We'll see number 7 impacts his knee at that point in time. And unfortunately, Payton just grabs his knee. I mean, in NBA, when someone's got a knee injury or grabs their knee, we're thinking, oh crap, is this an ACL? Because that can be season ending, it could even be career ending. So let's go back and break this down. Okay, so we'll see Payton is trying to defend. And unfortunately here, his teammate number 7, I mean, arguably I'm wondering whether or not he really flopped down to the degree he did. Definitely a possibility. I just felt like the force that was given to him may not have been as much to really cause the fall that he had had. Although it's hard to tell when you're not in the game. And you'll see here, this right foot is planted, but it's also rotated inward. So your knee is kind of collapsing inside. And you'll see that he falls directly on that as his foot is planting down. So unfortunately he got, if this was the knee right here, he had a lateral force applied to his knee. And kind of immediately, you'll see he goes down, grabs the knee, and looks quite worried in many cases. Now, reports state that he has a knee sprain and he's out right now. We don't know how long, we don't know what happened. Now, with an injury like this, what is a sprain? So first off, a sprain involves ligaments. And those are things that connect bone to bone. So we have a multitude of ligaments in our knee. So you have 4 main ligaments in the knee. You have 2 that are intra-articular, your ACL and PCL, and you have 2 that are extra-articular, your MCL and LCL, so outside of the joint. Now, if we look at a specimen here, so this here is looking at the bottom of the right leg. I've taken off the top femur bone, and we're just looking at the knee joint opened up. This here is your LCL ligament on the outside, stabilizing the lateral aspect of the knee. This here is your MCL ligament, stabilizing the medial aspect of your knee. If we go into the actual joint here, those are our 2 menisci that we will commonly hear quite a lot of injuries about, especially in athletes. And then you have your 2 big guns. So this is your ACL here, this guy, which can be season ending for most people. And you have your PCL here. So when someone's talking about a sprain, they're talking about a tear of one of these ligaments. Now, the definition of a sprain changes in regards to how bad it is. A sprain isn't just really a stretch of a ligament, but it's a spectrum. So you have 3 main grades, and I'm going to put up a picture here as well as a list to kind of overview grade 1, 2, and 3 injuries. Now, a grade 1 injury is mild. It is microscopic tears in the ligament. So if you think about this being your ACL or MCL fibers, you know, some of them may have microscopically torn and increased in size. Then you have a grade 2 injury, which is more of your moderate injuries. So for example, it's a partial tear, so maybe half of the fibers have completely gone, and you still have some intact. And a grade 3 is pretty much a full rupture, and that's what you're thinking of when you see things like Markelle Fultz, for example, completely blow his ACL. Those are bad, those will take you out for a while. Now, in terms of how long and how severe this injury will be to Payton, it really depends on what structures are damaged. So likely he will be getting an MRI to further characterize what type of sprain he has and what type of ligaments are impacted. But usually you want to look at the mechanism of injury when you're really trying to figure out what ligaments are going on. So we'll see here that his knee gets collapsed inward. So there's this inward directing force of the knee, really opening up the medial aspect. So in this case, I am going to be worried about his MCL. It's a very common mechanism to really sprain your MCL. The other area I'd be worried about, especially because he pivoted down and then someone kind of hit the lateral aspect of his knee, is an ACL injury. That's one of the mechanisms. MCLs and ACLs tend to get injured together, so it's definitely on my radar. I'm not too worried about the LCL in this case. The mechanism just doesn't really lead to an injury in that area. And the last one is the PCL. So the PCL is a bit of a funny type of ligament. It is one that you don't really see injured in isolation and don't really see injured in sports as often. For a PCL injury to happen, you typically have to have a force vector coming from this area of the front of your tibia directing backwards, so essentially this way here. And usually you see that in kind of dashboard injuries and in areas where the knee is slightly bent and then someone hits the bottom of your shin bone. I'm not super convinced that that was the complete mechanism here, although it's definitely on my radar that we're going to have to check the PCL out. Now on the sidelines, the one thing I noticed was Payton was quite worried. He immediately fell down and grabbed his knee to the point where he wouldn't even put weight on it. That's worrisome because in some mild knee sprains, you can get up and walk off the court. Whether or not he was just protecting the knee or if he was in that much amount of pain can lead to maybe this potentially being a more severe injury. The other thing I want to bring your attention to, this right knee actually looks and appears a little bit larger than the left. Now, I mean, you can still see the contours of his vastus medialis, which is his quad, and his kneecap. But I mean, when I'm looking at it grossly, it definitely looks like there's a little bit of swelling to me. What does that mean? If we're looking at immediate swelling within the knee, then we're worried for a more severe injury just because it causes a more acute reaction within the knee. Now, I have no doubt that he's going to be getting his MRI and we'll be figuring out what injuries to what structures actually happened. Usually as a doctor on the sidelines, if I took him back into the locker room, depending on how swollen and painful the knee is, my exam may actually be not that accurate. So that begs the question, how long will Payton be out? Well, typically if you have an MCL injury, so an injury to that outside middle knee ligament, usually grade 1 or 2 injuries keep you out for 2 to 4 weeks. And you're good to come back. You may be able to wear a double hinged knee brace. I'll put that up here so you can reference it. And you're good to go. They're not that bad. ACL and PCL injuries can be a bit more severe. So if it's an ACL, kind of grade 1 injury, a little bit of a stretch with some micro tearing, you may be able to rehab that back. But he may be looking at more of a time off than just 2 to 4 weeks because the ACL is very, very, very important in stabilizing, especially with rotational forces. I have seen athletes actually play on deficient PCLs. When I get some more information, I'll leave a comment down below. We can talk a little bit more about the actual injury he sustains once his MRI is complete. Be sure to like and subscribe if you found this video helpful. And for those of you who have any questions or comments, definitely leave them down below. For now, that's all.